Hello viewers, I am Dr. Chandra Sekhar, orthopedic consultant in Care Hospital, Banjara Hills, Hyderabad. Today we will get to know about a few things regarding carpal tunnel syndrome and the various treatment options for it. Carpal tunnel syndrome is one of the commonest peripheral nerve entrapment neuropathic conditions. There is a nerve called as median nerve which passes through a small tunnel around the wrist area on the front aspect of the wrist, and in a few conditions this nerve can be encroached or compressed upon for various reasons. In about 50% of the patients, the exact cause for this carpal tunnel syndrome is not known. However, it can be associated with a few other systemic conditions like diabetes mellitus, hypothyroidism, and also as an occupational hazard where people involved in using excessive machinery and vibratory tools. And the commonest symptom of carpal tunnel syndrome is pain all along the hand and the forearm, and sometimes tingling sensation or electric shock like sensation in the thumb, index and the middle fingers. Occasionally in late cases, the patient also may experience a sense of weakness with wasting of certain muscles around the hand. The best way to identify a carpal tunnel syndrome is clinical, where the patient has to see an orthopedic surgeon and give proper history, and during the assessment the clinician does a few tests which will help to provoke the median nerve which is already entrapped. If the provocative tests are positive, then most of the time it is confirmatory, and if there is any doubt, then the patient has to undergo a few tests, and the most common one is the nerve conduction test, which will help to identify if there is any blockage to the conduction of electrical impulses along the median nerve. And once the tests are confirmatory of carpal tunnel syndrome, then depending on the severity of the entrapment, whether it is mild, moderate or severe, the clinician will advise about the various treatment options. In some people, the carpal tunnel syndrome can be physiological, wherein it can happen during pregnancy as well. So this is usually transient. It settles once the baby has been delivered. However, in most cases it is secondary to other underlying problems, wherein the initial line of treatment is using night splints to help give rest to the median nerve and avoiding any strenuous activities and doing physiotherapy regimen. There are a few medications which will help with recovery as well, but in moderate to severe cases, the preferred line of treatment is surgical, though a few clinicians would consider giving local corticosteroid injections within the carpal tunnel. There is a high chance of relapse with steroid injections. The success rate of surgery is quite high, and if the diagnosis is correct, the patient can undergo a simple surgery called as carpal tunnel release, which is done under local anesthetic as a daycare procedure. The usual recovery time following the surgery is about 4 to 6 weeks. Once the nerve entrapment is released, then the median nerve becomes free to function, but the recovery time can be delayed like with any other neurological conditions. If the condition is left for too long without any treatment, there is a chance of incomplete relief from the symptoms, and especially the incomplete relief can happen if the patient also has other neurological conditions or if there is any entrapment of the nerve in the spinal cord in the neck. So it's important that the clinician properly assesses the patient to see if he is actually dealing with carpal tunnel syndrome or with any other condition. If it is a pure carpal tunnel syndrome and if it is moderate to severe enough, then surgery would be a preferred line of treatment for this neurological condition. Thank you.